Hello and welcome to this week's presentation on cerebral vascular accident by Jessica Stanley. Medical term cerebral vascular accident refers to a stroke. A CVA is a neurological disorder characterized by blockage of blood vessels. Clots form in the brain and interrupt blood flow, clogging arteries and causing blood vessels to break, leading to bleeding. Rupture of the arteries leading to the brain during the stroke result in the sudden death of brain cells owing to a lack of oxygen. A stroke can be classified by the etiology and are referred to as ischemic cerebral vascular accidents or hemorrhagic cerebral vascular accidents. The disease is a neurological disorder characterized by damaged or blocked blood vessels of the brain. When blood vessels in the brain are affected, this is what leads to a stroke. Strokes are a primary disease of people over the age of 65, but have been diagnosed in people under 45. According to statistics, strokes are very common and are considered to be the second leading cause of death worldwide. This disease causes a high rate of post-stroke complications, leaving many sufferers with long-term negative effects. So the pathophysiology of a stroke is defined as an abrupt neurological outburst caused by impaired perfusion through the blood vessels to the brain. It is important to understand the neurovascular anatomy to study the clinical manifestations of a stroke. The blood flow to the brain is managed by two internal carotid arteries anteriorly and two cerebral arteries posteriorly. This is often referred to as the circle of Willis. Ischemic stroke is caused by deficient blood and oxygen supply to the brain. A hemorrhagic stroke is caused by bleeding or leaky blood vessels. In a thrombosis, the blood flow is affected by narrowing of vessels due to an atherosclerosis. The buildup of plaque will eventually constrict the vascular chamber and form clots, causing a thrombotic stroke. In a thrombotic stroke, decreased blood flow to the brain region causes an embolism, and the blood flow to the brain is reduced, causing severe stress and ultimately necrosis or cell death. Necrosis is followed by disruption of the plasma membrane and swelling and leaking of cellular contents into the extracellular space, which then impairs neuronal function. The stroke pathology also involves inflammation, energy failure, loss of homeostasis, acidosis, increased intracellular calcium levels, and cytokine-mediated cytotoxicity. A hemorrhagic stroke accounts for the rest of all strokes. In this case, stress in the brain tissue and internal injury causes blood vessels to rupture and produces toxic effects in the vascular system. This then results in an infarction. It can be classified into an intracerebral and subarachnoid hemorrhage. In an intracranial hemorrhage, blood vessels rupture and cause abnormal accumulation of blood within the brain. The main reasons for intracranial hemorrhage are hypertension, disrupted vasculature, excessive use of anticoagulants, or thrombolytic agents. In a subarachnoid hemorrhage, blood accumulates in the subarachnoid space of the brain due to a head injury or cerebral aneurysm. Risk factors for a CVA include having a previous transient ischemic attack or a TIA. If you've already had a TIA, also known as a mini stroke, your chances of having another stroke are extremely high. High blood pressure is also a leading cause of stroke. It can occur when the pressure of the blood vessels in your artery is too high. Cholesterol buildup in the arteries can also lead to narrowing of the arteries, and coronary artery disease increases your risk for stroke because plaque builds up in the arteries and blocks the flow of oxygen-rich blood to the brain. Also, having heart valve defects, irregular heartbeats, including atrial fibrillation, and enlarged heart chambers can cause blood clots that may break loose and cause a stroke. Diabetes can cause strokes as well due to a buildup in sugar in the blood vessels, which prevents the oxygen from flowing through appropriately. Obesity or excessive body fat is linked to high bad cholesterol and triglycerides, and it lowers the good cholesterol, therefore leading to hypertension and predisposing you to a CVA. Another risk factor is having sickle cell disease because some red blood cells that are formed in the abnormal shape can get stuck in the blood vessels and obstruct blood flow to the brain. Lifestyle choices include eating excessive saturated fats and trans fats, and cholesterol as well as sodium, which raise your blood pressure and lead to a CVA. And lastly, smoking tobacco can weaken blood vessels and cause chronic inflammation and damage, leading to a CVA. Signs of stroke in men and women include sudden numbness or weakness in the face, arms or legs, especially unilaterally or one side of the body. There can be sudden confusion, trouble speaking, or difficulty understanding their speech, as well as they will complain of a sudden vision changes such as trouble seeing in one or both eyes, a sudden trouble in walking, dizziness, loss of balance, or lack of coordination. There can also be a severe headache as well. The acronym for stroke is sometimes known as FAST, and that means if you see a facial droop, if the arm is drifting downward, if their speech is slurred. T stands for time, and time is of the essence when these symptoms occur, because the faster these signs and symptoms are noticed, the faster treatment can occur. Some tests that can be done to identify stroke is a physical exam. A healthcare provider can do a blood pressure check as well as a neurological exam to see if there are any potential factors leading to a stroke. Blood tests can include whether or not seeing if the blood sugar is too high, or also seeing if there's an infection present, and a computerized tomography or a CT. A CT scan uses a series of x-rays to create a detailed image of the brain, and the brain image can show if there's bleeding in the brain, if it's an ischemic stroke, or if there's a tumor or other conditions that may be causing the symptoms that are present. There may be dye injected into the bloodstream, and that can show the blood vessels in the neck and brain in a greater detail, which will allow for a better diagnosis. There can also be a magnetic resonance imaging or an MRI, and this uses powerful radio waves in a magnetic field to create a detailed image of the brain, which can detect damaged tissue from an ischemic stroke or a brain hemorrhage. Carotid ultrasounds can also be performed, and in this test, sound waves will create a detailed image inside the carotid arteries of the neck, and a carotid ultrasound will show a buildup of fatty deposits or plaques that are reducing blood flow to the brain. And lastly, a cerebral angiogram, which is a test that is less common, but it can provide a detailed view of the arteries in the brain and the neck. And this is where a flexible tube or catheter is inserted through a small incision, and usually in the groin, and then the tube is guided to the major arteries in the carotid or vertebral artery in the neck, and a dye is injected to show the arteries under an x-ray image. And also echocardiograms can be used to show if there are clots in the heart that may have traveled to the brain and caused the stroke. Treatment is based on the etiology of the stroke. If it's an ischemic stroke, blood vessels in the brain are blocked or narrowed, and during a hemorrhagic stroke, there is bleeding in the brain. Ischemic strokes are typically treated with IV TPA, or a medication that bursts the clots into little pieces quickly to restore blood flow into the occluded artery. Treating an ischemic stroke has to be quickly to avoid damage to the brain tissue, and this can be done on an emergency basis in an endovascular procedure that deliver medicine directly to the brain through a catheter. And also there's something when there's a large vessel occlusion, they can go in and retrieve the clot using a stent. As well as recommended is a procedure that can open up the artery that is narrowed by a plaque. There is also a carotid endarterectomy, which means that the surgery that removes the plaque blocking the carotid artery can reduce the risk of the ischemic stroke. And angioplasty and stents. In an angioplasty, surgeon threads a catheter into the carotid artery through the artery in the groin, and a balloon is then inflated, and the stent can be inserted to support the artery remaining open to help blood flow to the area. If a patient is having a hemorrhagic stroke, if this is an emergency treatment that would need to happen, and transfusions would need to happen to elevate the blood levels. And lastly, surgery can be done if the bleeding is large. They might have to go in there and repair the blood vessel damage. And here are the references attached, and thank you so much for listening.